Memorial Medical Center in uptown New Orleans was not prepared for such a disaster to hit its doors. As many as 200 patients became trapped inside the facility with limited electrical power and no running water, while temperatures peaked to just above 100 degrees Fahrenheit. This EF5 tornado severely damaged Mercy Hospital, forcing the facility to evacuate 183 patients from its uninhabitable grounds immediately after the tornado. Patients were moved through 9 flights of damaged stairwells with no lighting and often with flying debris from inside and outside the building. Immense flooding caused the failure of hospital generators at the height of the storm, forcing New York University Langone Medical Center to evacuate 300 ICU patients from its facility. During the evacuation, patients were being carried down flights of stairs on stretchers and taken outside to awaiting ambulances. In the middle of the storm, gusts of wind blew patient blankets away, threatening the already compromised patient comfort as well as exasperating alterations of acuity due to exposure. Such events are sudden, cause great damage or loss of life, and cannot be prevented. Due to these spontaneous and often unpredictable occurrences, medical facilities must be prepared to react to natural disasters quickly and efficiently. In the event of a man-made or natural disaster, as just described, the rate of success boils down to mere minutes it takes to properly evacuate patients with as much care as possible. But do hospitals currently have emergency medical equipment easily stored in every patient's room, readily available at all times? Does their current medical device offer quick, efficient, patient-friendly transportation during such physical, mental, and emotionally challenging situations? Hospitals, thought to be safe havens for extreme emergencies, have more frequently found themselves debating over best practices in regards to shelter in place or evacuation. At Acute Design, originators of the TheEvacuGrip, our main goal is immediate identification and use of resources readily available to most, if not all, non-ambulatory patients in the event of a need for evacuation. Pre-planning for disasters requiring evacuation requires identification of teams, documentation of pre-approved and most appropriate exit routes, and the identification of patient categories and their severity of needs, in which triage may be necessary. Many organizations may have already addressed these needs and converted them into practices and policies, but they may have omitted one aspect: the most simple and practical patient packaging process. The patient packaging process begins with the existing linen the patient is lying on. Keep the patient's bed at its current or comfortable working height for team members. If there is a threat of potential power loss, one may lower the patient's bed first, but working conditions may strain the back of team members. Pack all existing linen around the patient until the entire mattress is exposed and not tie the feet together using the linen. Second, unzip the entire upper pillow top portion of the patient's mattress and disconnect all air hose attachments. Third, the TheEvacuGrips will be attached directly on both lateral sides of the pillow top at 3 strategic points: the patient's feet and ankle area, waistline, and shoulders. To close the clamps, turn the knob to the left. Fourth, exchange straps with the team member directly across the patient. Once straps are exchanged, team members should tuck the strap underneath the patient's rear side, exchanging the straps once more. This action creates a circular and secure packaging, preparing the patient for transportation. Tuck the handles of the straps into the sides of the patient just above the clamp connections to reduce the chance of the straps unraveling when the patient is removed from the bed. Be sure to repeat the wrapping process with all straps, securing every clamp connection point before proceeding. When doing so, be careful not to attach too close to the patient's head, keeping the shoulder clamps aligned just below or mid-clavicle level. In the event of a power failure and the inability to obtain EMRs, patient charts may be bundled with the patient upon transportation by placing them in the existing cassette pocket of each pillow top. Medical supplies and IV infusions may also be moved with the patient when being bundled for transportation. Finally, once all the clamp connections are secure and the patient is wrapped, lower the bed to its lowest position. Then, with all the appropriate number of staff, rotate the patient feet first to begin the transition off the bed. The suitable amount of staff may vary as the number is dependent upon patient weight and height. Gently slide the patient off the bed with appropriate support of the patient's neck and head by allowing the feet to touch the ground first, slowly followed by the remainder of the patient's body until the head is resting on the floor. Again, with the appropriate number of team members, grab the handles to pull the patient to safety following the pre-designated path. Sliding the patient on the detached pillow top mattress works on any terrain. If the medical facility experiences loss of power, each TheEvacuGrip contains 1 to 2 small LEDs to assist in not only the clamping, but also help illuminate the pathway and possibly identify the acuity level of the patient. Once the patient is in a secure location, the pillow top can be converted into a comfortable sleeping bag or filled with air when hose connections are reattached. Reinflate or move air through the pillow top to give the patient a more comfortable resting position. This may aid in the prevention of skin and tissue breakdown that comes with exposure on a hard or rigid surface. The movement of patients during a natural disaster needs to be quick, efficient, and patient-friendly. Not only is the patient well secured, but comfortably cocooned from debris and threatening weather conditions. Timing is key when lives are at stake. The less time taken to properly transport a patient to safety allows for more patients to be assisted, which may result in more lives saved. The demonstration just previewed has been clocked at 1 minute and 47 seconds by non-clinical personnel who learned the process just minutes before attempting it. During any disaster, a medical facility's top concern is the safety of its patient. The TheEvacuGrip concept is built not only with the patient's comfort in mind, but also focused on moving patients safely and efficiently.